Good evening. I would like to call this OMBGA Budget Committee meeting to order for the continuing of our departmental budget hearings for today, April 13th, 2023. My name is Councilman TJ Clark. I am the co-chair for the OMBGA committee and the majority leader for the City Council. We are joined by my co-chair and Council President Mallory Rosado, Councilwoman Shirley Surgeon, and also to Councilman Amilcar Hernandez. And so we have with us today the Health and Human Services Department and the Human Resources Department. Up first, we have Director Leonie Arroyo, who this is her sixth and final budget presentation before the committee, and we want to thank her for her hard work during the course of her 6 years. Not sure if they are short or long, but they've been impactful to the city of Hartford, and she has her team with her in the back, and Carmen Chaparro, who is another good means of support for the Health and Human Services Department. So, Director Roy, you may take it away.
Okay. So thank you very much, Majority Leader Clark, Council President Rosado, new Council Member Hernandez, and Councilwoman Surgeon. Appreciate this opportunity.
One second, I'm sorry. I neglected to mention we are joined by also to Councilwoman Tiana Hercules as well.
Good afternoon, good evening, Councilwoman Hercules.
Good evening, Director.
So thank you all for being here this evening to go over our recommended budget to the council. This budget was worked on by a great team of individuals at the city, at our health department, two of which are seated with me. Carmen Chaparro, our project leader within the department, and Mohammed Kordi, our management services officer. Both of them, along with individuals behind me. We have two of our epidemiologists, if you want to raise your hands. Jessica and Mike, another key member of our finance team, Andre, and then Faith, who serves as our operations manager, who works very closely with me on all things in the department. So this is just a bit of the team, but I would not be where I'm at today, and we wouldn't be able to do the things we do in the department if it wasn't for them and the rest of the team that's not here, our over 56 strong department. Next. We're having some technical difficulties. Oh, there you go. Oh, that one. Okay, thank you. So as you're all aware, just briefly to go over our mission, it is to, our department aims to protect the well-being of Hartford residents, promote an environment conducive to healthy lifestyles, and to prevent adverse health outcomes through needs assessment and provision of quality services. Next slide. This is our department program chart. So we consist of 5 divisions: disease prevention and health promotion, maternal and child health, senior and community services, environmental health, and administration. As you see in our legend, we have 6 programs, and there was a mistake, so I fixed it on mine, but there are 6 programs that are both grants and general funded. The one that's missing on your slide is the NCAA Home Help, which is funded by both grants and the City of Hartford. There are 10 programs that are only funded by the general funds, 15 programs that are funded by grants, and then we have 3 special projects / grants, and those are 3 of them that are around COVID and other infectious diseases. Just briefly, the funding that we receive, what comes in, half or more than half of it goes out into the community as well. So in FY23 of our $5.4 million budget, it is projected that by the end of the year, over $2.9 million will go out into the community and a host of different services that we provide, with a large focus in our senior and community services division, where a lot of that funding goes out to. And on the grant side, it's pretty similar as well. Usually anywhere from 45 to 50% of our grants as a whole will go out into the community, and some of our grants, upwards of 85%, go out into the community. Next. So here is a composition. Currently, we have 56 staff, 50 are full-time, 6 are part-time. We are funded for 71 positions, 71 full-time equivalents. Some of those are also part-timers in there. Our residency is slightly over 40%, are residents of the city of Hartford, with slightly over 57% being non-Hartford residents. And then you have our ethnicity breakdown there. We have 16 Latino Hispanic members of our staff, accounting for nearly 29%. We have 25 African American and Black staff members, so that's about 45%. We have about 20% Caucasian, which amounts to 11 individuals, 3 Asians in the department, and then 1 person that identified as other. So as you can see, our department is diverse, and we pride ourselves on trying to find diverse candidates that look like our community or speak the languages and have experience with community members like ours. And then the gender breakdown, similar to other places in public health, when you look at the public health workforce, it tends to be overwhelmingly female, and that is no different than in our department. So nearly 70% of our staff identify as female, 15, which is slightly under 27% is male, and 2 prefer not to say. I will say, as I noted earlier, we do have a vacancy rate at about 21%, which is lower than we were last year. So we work very hard with HR to fill these positions. Similar to other departments as well as other industries, it's hard. We bring people in, and then sometimes a couple of months later they're leaving because they have other opportunities. It's not always for pay. Sometimes it's closer to their home. Sometimes their situation changes, and so they choose to leave. But we're running into that same problem that other departments and other industries are working in. But we do, within those 15 vacancies that we have 1 that will be starting soon. It's currently vacant, but someone will be starting soon, and 2 that are receiving offers in the next week. So we will continue to bring that vacancy rate down. Next. And then, as I mention every year, here are 10 essential public health services. This is the work that is funded by both grants and our general fund money. And as I normally do, I try to tell a little story so you can understand how we do work with this. And this year I'll use the Mpox epidemic that occurred. So last couple years I've used COVID, and this past year Mpox came. And so similar to what we did with COVID, we were monitoring the situation, particularly because a lot of what was happening in Florida and in New York. And we know there's a lot of travel from the Northeast to Florida and also to New York from Connecticut. And so we started looking at that. And as soon as we got our first cases, we started working with community members that were most affected. Now, as everyone knows, Mpox can affect anyone, but there were certain community members that were most at risk, and we immediately began communicating with the groups that work with them. We worked with them to provide education and in some cases some additional funding to be able to get vaccines into arms. And again, that mobilizing of community partnerships was really critical in ensuring that we were able to bring people into our office, but into other offices and other programs that were vaccinating throughout the city. We did have, luckily, what we did with COVID, developing policies on how to help people safely quarantine and isolate in their home. So we were able to very quickly restart that process again. People needed towels, they needed food, they needed other assistance, and we were able to quickly use our funding that we had available, some of which through the state and some of which through allocated ARPA funds that we had received from the city, to be able to meet needs of community members that had to isolate. And as we did, we continued to link people to health services. We became aware of individuals who didn't have health care insurance, and we linked them with services that they can provide that, and worked with our staff to continually educate them. So we're using those lessons learned to do a campaign starting again in May, in gearing up. As many folks know, June is Pride Month, and so we've already been told by the state that we may be seeing an uptick around some of these, more infections. We hadn't seen any in a while, and so we're in preparation for that. We'll be going out, doing vaccinations, ensuring that people have information and access to that, and always with a focus on equity. We knew, similar to COVID, that we needed to make sure that those most at risk, that those in our Latino and African American communities had access to this vaccine, and we worked very closely with our partners to be able to do that, and we'll continue to do that as well. Next. So some brief highlights. I know that we've had lots of conversation and there's been lots of articles around rodents. in the city. And so for the first time since I've been with the city, we have a fully staffed rodent unit. So that's 3 inspectors, and we're really excited about that. So now we'll be able, and we are going out doing many inspections. So in the first 6 months, we've done over 780 inspections for rodents. We've baited 64 properties, and why that's weighted differently, just so that you know, before we bait a property, we work very closely on integrated pest management, because that is the first step. Baiting is the last step that we do. We have to take care of all of the issues first before we can successfully bait. And when you bait properties, you're actually baiting them for a period of anywhere from 2 to 4 weeks to help control the population. So we're working very closely with that. We're also trying out new technologies, and so I was just given this. This is a Bluetooth, Wi-Fi enabled fun rat trap that'll go inside bait boxes. There's a SIM card that goes on the under part. It'll be placed in a bait box. When a rat is trapped outside, we're gonna get a notification. We can clean the trap, dispose of the rodent, and keep going out there. So this is something new in our arsenal for next year. So again, since I've been here, I was told that it was going to be opioids, rodents, and teen pregnancy. And so now we're dealing with rodents, but we've done a lot of work in the rodent area, and this will be deployed come later this summer throughout the city. And this is in collaboration with our rodent birth control program, which we deployed in Bushnell Park with great success. And we're working and deploying that in other areas of the city as well, in sort of hot spots. And we did see some success with that in the Frog Hollow neighborhood, a huge noticeable difference in a particular area that we received many complaints. But it's a partnership between the property owners and the city. And when one piece of that falls off, then it becomes problematic again. So we're continuing to look at what tools we have in our toolbox around ordinances to do more enforcement around this issue, and we're working very closely with our blight director at DDS around this as well. Very proud and pleased to report that we've delivered nearly 30,000 COVID vaccines since January 2021, which may be a drop in the bucket compared to our larger partners, but we never expected to do as many COVID vaccines as we have done, and we continue to do them, including up until 2 weeks ago, we were getting individuals getting first doses. So we continually see people coming in. We've submitted 11 grants this year. 2 have been funded. We're awaiting decisions on 9 of them. 3 are for new funding. 2 grants are for new funding. And then we have 2 additional grants that we'll be submitting, 1 next week and 1 in early May. So continue to really look at grants to be able to increase the work that we're doing, particularly around teen pregnancy, harm reduction, and homelessness amongst the elderly. So those are new grants that we'll be submitting as well. And then I've been here, again, 6 times. We continue to talk about the Public Health Accreditation Board. We've now submitted the first piece of that application, which has been accepted. And this journey, we were looking through old notes, has been 10 years. And we've submitted that first application. And so we're looking forward to continuing that journey. And hopefully the next director will be here telling you we've been accredited next year. And we've also restructured some programs to better serve residents, particularly in our senior and community services. Initially, when the round of layoffs happened, our department was pretty hard hit in some of our areas, and working hand in hand with the mayor and the COO, we've been able to bring many of those positions back over time. And so we've been able to restructure our senior and community services division and continue that process to better serve and react to and be proactive with our community members around certain issues. Next. Strategic initiatives for the upcoming year. Submit our final accreditation application to the Public Health Accreditation Board and receive accreditation. Now that we're fully staffed, we can develop a comprehensive rodent control plan for the city with all the new tools and things that we have. Move from the pandemic phase to the endemic phase as it relates to COVID-19. As you all know, on May 11th, the emergency will end. And that's going to mean a host of changes, some of which have been discussed. So we're going to be working on that and seeking additional resources as free testing ends and things like that. We have been accepted to a program to obtain free tests as we need them. So we'll be utilizing that program over time as surges happen to be able to have home tests available. We continue to identify additional funding sources to expand our footprint that are identified in our community health improvement plan. And we mentioned fully deploying the new rodent control tactics. We were lucky enough to receive a large grant from the state on workforce development, and so we're going to be working on a plan for that to ensure that our staff knows what's happening, what is up to date on new issues, and that we're ready for whatever else comes our way. And then lastly, through our use of the ARPA funds that have been put to us, we're looking at implementing a sexual health program through our department clinic. The COVID has caused a rise in sexually transmitted infections throughout the city, and not just throughout the city, but throughout the state and throughout the country. And we want to make sure that we're being aggressive and proactive in doing that work. So we'll be working on that and unveiling that over the next year to expand our capacity. Next. And then a budget comparison. So you can see there is a rather large jump in our grants because we've received 3 new grants in the last fiscal year that will be continuing into the next fiscal year. So that jump of $3 million, that money's coming from our Ryan White program, which is state funded. We are now a Part B funded entity through the state. So that's an additional $1.7 million that has come into the city, and not just into the city. We serve the region. We serve Hartford, Tolland, and Middlesex counties, with the majority of our dollars being in Hartford County and Hartford and New Britain area, because that's where the majority of the infections stem from. The $1 million in lead funding is accounted in that, and then some smaller grants that we have that are accounted in that, the new recommended. And then in the general fund, you'll see an increase in terms of the budget there. That is some changes in positions that we've made in order to better serve the department. So creating opportunities for promotion for the work that people were doing, changing some positions, one position from a grant funded to a general funded position because it better suited the needs of the department, increasing a position from a program manager to a senior program manager because of the work, and really creating equity across the department in terms of the work. We've been granted in the next year part-time staff for warming and cooling centers, which has been a problem for us. We've relied on volunteers or having to bring in outside staff, and now we've been provided funding to be able to have part-time on-call staff for when they're needed to fund, to staff the warming and cooling centers. We also, as you may know, run the rental rebate program for the state of Connecticut. It is an unfunded mandate, and so we have to put staff to be able to do that. And we've been granted some part-time rental rebate staff, so 6-month part-timers that will come in and help. And just for context, our team of 1 person with volunteers processed over 5,000 applications and brought nearly $3 million into the city in terms of refunds from the state of Connecticut. And that's mainly to our elderly population as well as to our over 18 population that's disabled. And then we added additional money to our No Free Shelter because of we went from a warming center to a larger, really true shelter model, and more funding was needed for that, as well as some increases to the McKinney budget because they had increases that they had to make for their staff. Next. And then lastly, some areas of focus that we'll work on that are important to the department. Many of you may be familiar with the community health workers that were out there during COVID and the success that they had in bringing people to our clinics and educating people and helping keep people safe in the early phase of the pandemic. We continue to find ways. We want to build on that, and we want to integrate them into all of our programs. So all the grants that are going out, we're putting funding in those grants for workers on the ground in the community. Funding is always something that we're looking for in terms of specific programs in new areas, and so we'll continue to do that. We hadn't applied for lots of grants over the last couple years because of COVID. Money was just coming down for COVID, but this year we made a big effort to actually apply for many grants to identify needs that resulted from COVID. And then social determinants of health. What we learned from COVID was that addressing one need was not addressing the entire need. And so while we were telling people to stay home and stay safe, people that were isolating needed groceries. They needed cleaning supplies to keep their families safe. And so it was really critical for us to engage in new partnerships with community groups and to be prepared to address that work when needed. And so we want to continue to do that work and continue to address those issues within our grants as well whenever possible. And that is the end of my formal presentation.
Thank you so much for that thorough presentation. I would like to offer the opportunity for questions from my council colleagues. Councilwoman Hercules, do you have any questions?
I do not. Thank you so much.
You're welcome. Council President Rosado?
Yes, I don't have any questions. I just want to thank you for your service, and we will miss you, but at least we still have you in Hartford, right? And to commend your staff for the great job that they do. I do have here a memo from Councilman LeBron, which states, Councilman Nick LeBron regrets not being in attendance and sends his apologies. He had a previously scheduled commitment to a majoral debate being held today. And he has 3 questions for HHS. The first one being, given the recent article in the Hartford Courant, if we were fully staffed, would those egregious violations have occurred? And he's talking about the
Yes,
article.
familiar with the article.
Yes.
So I will say this, we've never truly been fully staffed since I've been here, and it's not necessarily a Hartford issue, to be clear. It's a statewide issue as it relates to sanitarians, or what we'll refer to as certified food inspectors. What the actual term in the state is sanitarians. There have been numerous articles from around the state about the lack of certified food inspectors available to be hired. And so if we had more inspectors, we would be able to do more inspections, absolutely. And we would be able to find these examples earlier, 100%. And so we continue to work very closely with HR on this issue. Many years ago, when this issue started becoming more familiar to the city, where we weren't getting as many applicants, there was a classification, I think it was right before I came on board, called environmental health trainee. And so we continue to utilize that particular job classification to bring people in and train them. There was a backup with the state at one point, and so we currently have 3 trainees that are in the process of becoming certified food inspectors. What I will say about the article is inspections, catching these things is a result of inspections happening, right? That's a good thing. No one wants to know that that's happening, but we have made many strides since I got here till this point in time. When I first got here, I couldn't get an answer as to how many restaurants or food service establishments we had in the city. Today, I can give you that number. I can tell you how many what are called class 4 restaurants, that everything is cooked from scratch. I can tell you that number today. So while we do have a long way to go, we have made tremendous strides in that particular division.
Thank you. And this is my question. So sometimes I walk into restaurants and I see that letter A, B, or C. Is that a list that you guys go through? And once you inspect that restaurant, you do that? Because I don't see them on a lot of restaurants. That's my question.
Yes. So the ABC was created. Many other folks, many other health departments across the state did the same thing. It was modeled after what happened in New York when they started their grading system. Now we're under a new food code, and having that grading system doesn't really work. And so we've not been issuing new letters. So you will see some old letters, you'll look at me like, this place hasn't been inspected since. No, that's not the case. We've just not been issuing new letters because the food code has changed. And so we were preparing for that eventual change, which happened in February. So we've reached out to Corporation Counsel about an ordinance change on that piece, because that is written in our ordinance, and a better way to reflect what's happening in restaurants so that people are aware of that.
Okay, so is it safe to say that there will come a time that for every restaurant we enter in the city of Hartford, we'll see a letter outside their door?
I can't say that we'll see a letter because the new food code makes it very challenging. We're part of a working group right now with other health departments in the area to discuss this very issue.
Thank you, Director Arroyo. His second question, how has the blight remediation team partnered with the land bank?
Well, the blight remediation team is under DDS, so I would have to defer to DDS to answer that question. We work hand in hand with blight remediation because they have some properties that are on their blight list, and then we deal with nuisance properties, so overgrown grass, garbage, vegetation, and so we'll work closely with them, but that's not something that's under our purview.
Okay.
in terms of working with the blight team working with the land bank.
I would say, because I was around when the, what was it first called? LSNI, Livable Sustainable Neighborhood Initiative. That was always under DDS, and then the overgrown weeds and vegetation was always a portion that HHS covered, so.
Maybe that's what he tried to ask. And then the third question, it states here, within the Women and Infant Children WIC health program, how many staff are DCF mandated reporters and how many reports have been filed?
So he had reached out to me. So we are working on doing, it is my understanding in speaking with the head of that division, who is a mandated reporter because she's a licensed therapist, that they have done some initial training and have to do more because we have a lot of new staff in that division. It is my understanding that at this time they're not mandated reporters based on their classification. However, they do have a process of notifying the mandated reporter, which is our staff person that oversees the program, who's a licensed therapist, and that she will discuss with them and make the report herself if something comes to her attention.
Mr. Chair, that concludes my questions. Thank you, Director Arroyo.
Thank you. You have a question? Councilman Hernandez?
So, question. So the budget book shows that there is on page 34-6, that's all the way on the back, where it shows the grants that have been, or that are expected to be received. Once I saw that it changed about 30-something% compared to the recommended budget from the previous year. They went up from 8 million something to 11.3,
Yes.
at least the projection.
Yes.
Then I also see on the book on section 20, whatever the section is for the health department, further at the beginning, it also shows that part of the increase of the budget is because of the reallocation of grants back to general funding. But with the $3 million increase, I wanted to understand, with so much more money in grants, how do we take money and then put it back on the general fund? My assumption was originally that these are restricted grants that only fund specific functions, and you still have to fund some of the other positions, and you still have to then, use the general funding for that. Is that a correct assumption?
So one position was moved from grants to general funds, a senior project manager. We did that for a very specific reason. When I first came on board in December of 2017, 3 days after I came on board, we received notices from the state that we were going to lose 2 grants in our maternal and child health unit. At that point, there wasn't a senior person overseeing that division. We were able to get a grant that year, and we were able to put that person overseeing that work of maternal child health partially, not fully funded, just partially, because their main funding was for a grant that we had received that wasn't exactly connected or correlated with the work of the maternal and child health unit. What we saw with that even limited supervision over that unit, which it didn't have at the time, didn't have a senior person overseeing it, is that we saved our grants. We were able to keep 2 of the 3 grants, number one. We've expanded funding in one of those grants, and we've received national recognition because of that change. And so we requested this year to move that one particular position over onto the general fund. The rest of the increase in general fund is because of restructuring some of the positions that were already on general fund to promotional opportunities for staff, because what they were doing in their job was really exceeding the classification that they're currently in.
Perfect, thank you.
Councilwoman Surgeon?
Thank you, Mr. Chair. First, let me congratulate you. I know it's been a tough several years with the COVID and how you got the city through this. I was overly impressed. We were the first city. I like to brag when the city of Hartford, gets kudos for doing something, because we always hear the negative things that happens in the city. And on your I've only worked here for 4 years, And in my 4 years under your administration, I have limited, and I mean no complaints regarding Health and Human Services.
Thank you.
So that says a lot for me.
Thank you.
I think as you know, one of my major, I've joined the ranks of the seniors now, so I'm very partial to our funding for seniors, and I think you realize that over the last couple of budget we have worked on. So I do see that there's a slight increase in your senior budget, and I would like to know where that area is for.
So on the senior side, there was an increase of ARPA funds from last year that you all directed.
Yep.
And then for this year, we are receiving funds from the federal government. From the state pass-through funds. So state got their ARPA funds, and we're receiving ARPA funds for the senior centers as well. So we'll be working with them to put that into their budget increases so that they can sustain some of the work that they've been doing this past year.
So, for example, I know over the last several budget, the council has increased, for events for the seniors to go out after coming out of COVID. And believe me, I've seen some of the pictures, and I've been very
They're
envious.
having fun.
They have had some fun, and I am so happy for them because, they have given so much to our city, and this is our way of giving back. So have you considered, because through the council, we've always put about 40,000 for each senior center. Is that sort of built in here so we don't have to do that again this year?
My understanding, if I recall correctly, it's not built in here. I think it's the other funds that we have from the feds, but from the state. I'm sorry, I keep saying the feds. From the state, but I will confirm that.
If you would, because I'm sure through my council colleagues, if it's not for sure, we'll certainly, again, give a small donation for the seniors so they can continue their outings and enjoying, what they've been doing and since being locked up for COVID. So that is my only concern, Director.
Okay.
Just want to make sure the seniors are doing well. Now, the only concern, I think, over the last year or so, they didn't like the new food distribution system.
And we are working with them on that. So Andre was on a meeting with them, and we're working with the Hartford Provisions to identify new vendors for certain things that they might have. So that is one thing that we've been working on. And just for understanding as to why we changed vendors, we piggyback off of the state contract. And so the state changed their contract. And so we get more value, obviously piggybacking off of a state contract in terms of buying power. So that was why we did that. But we have had a meeting, we've taken their concerns and continually work to address them.
One of the things I do know of our seniors, we have a diverse population here in the city. And so I would always welcome them having the food they have grown up to eat. Of course, better nutrition wise. And so, if we can ever address that ethnicity, the diversity in the food that they would like, that would make a difference, I think, for surviving.
So I will say, when the food that they receive, those menus are created at the senior centers.
Okay.
With input from the senior center staff, the cooks, and there should be input from seniors as well, because they each have their councils and they work closely with them. Those menus, they have to have certain dietary guidelines that they follow. So there are licensed nutritionists, a registered dietitian that works with them, who's familiar with the populations. So each senior center gets a menu that is catered to the taste and the palates of each senior center. So that is something that we do work. I know there were complaints during COVID. Yes, we were doing sandwiches. It was lots of things going on. Our original plan was that our senior center cooks would continue to cook, and we would continue to work ways to get those meals out. Unfortunately, COVID hit the senior centers at the time that we were trying to do that, so we transitioned to a different model, and when things calmed down, we transitioned back to the model of our senior center cooks cooking and delivering, and then now we're back to our normal cafe model.
Yes, I was there for lunch. I think it was celebrating the Irish American Day, and I certainly The food was good.
Yeah, I enjoy eating at the senior center
do.
myself.
No, and for the price, which, believe me, they eat very well. So I do have to credit you, on the senior centers for how well they're doing.
They're great. We have a great team there across our two super senior centers, as we like to call them internally, and our two independently run ones. I do want to make a note.
Sure.
Of the funding that we receive from general fund, looking at last year's, this current year's budget, the $5.4 million, over $1.3 million of that is going to senior services. Just to be clear, that's about 25% of our budget that comes from the general fund is going to senior services. For context, seniors represent about 12% of the city's population. So we are funding senior services just so that our senior centers are funded at over $750,000 across all four of them. The Dollar Ride program is funded over $530,000. And then we have the Home Help program, which has $55,000 of funding coming from city coffers. This is all augmented with, and what was that? That's seniors. And Mohammed has brought up our McKinney shelter also helps seniors as well as our warming center as well. So we don't count that within this funding, but I'm just saying like funding that is specifically earmarked towards seniors, those are the big buckets, and that represents over $1.3 million of the $5.4 million that was allocated for us this year. So our senior centers, and that's also not including grant funding. So NCAA provides funding for many of these programs. The Department of Transportation provides funding for Dollar Ride, and we continually look for ways to expand our footprint with NCAA, which is the federal agency, the state-based agency that receives federal funding to distribute to senior services throughout the community.
Great, thank you. I know your service is coming to an end. I just do hope, I'm going to be very selfish, a director, but you don't take anybody with you.
I'm not planning to. I would feel bad if I did that.
You have developed a great staff, and I am hoping they stay with us and continue to provide the service that you have shown them how to do.
Listen, Carmen's been over 21 years with us now. Mohammed, like almost 10, 11 and change. I think our shortest one is Mike, right? So he's our shortest one. I don't think he's leaving soon. We have a great team.
Yes,
I'm not planning to take anybody with me, don't worry, unless they want to come, but I'm not planning to. I will say this, I have thoroughly enjoyed my service with the city of Hartford. Hartford has become home. I'm a homeowner here. My kids go to public school here, and I look forward to finding ways to continue to serve Hartford.
Thank you so very much for all your years of service.
Thank you.
And thank you for bringing us through the COVID pandemic to now. We're recovering. And
Thank
it's without your service, I don't know where Hartford will be. So again, thank you.
Without their service.
And thank all the staff for their many hours of service.
Thank you.
Thank you. Now it's my turn. I don't have any a lot of questions. I just want to start off by saying we've worked together for a few years now, and I'm glad to know that we'll be working with you in your new role right around the corner. So look forward to that continued relationship and partnership. From a budgetary question, what percent of your budget is regarding ARPA funds from the city and from the state?
Those funds are not accounted for in the request to council.
Okay, so that's separate.
That's a separate pot.
As you have broken that out in
Yep.
in your presentation.
That's a
Okay.
separate pot for us.
All right. You know, it's very interesting because our budget book never gives a full depiction of the health department's budget because it's always from the general fund standpoint. So it's good to know, and I wish that actually can be communicated to the public as to the total budget for the health department, because many people would think that the health department gets slighted, but evidently not.
Well, you make us work hard for our money, I'm just saying.
I remember the health department having a health services van or minibus. Is that still operational?
Barely, but part of our ARPA funding is to have a new van.
Okay.
So that will be part of our request for that sexual health services, but also for vaccines. So it won't be a mobile clinic, just to be sure, just to be clear, because that's a whole level of work beyond what we're capable of in terms of the work that we do as a department. But we are looking at creating that, getting a new mobile van, and that's part of our request with the ARPA funds to do that. So we'll be working on that over, by the time I leave, making sure all of that stuff is formalized with the COO's office and the mayor's office. But yes, that is part of our plan.
Now, do you know the cost for that van, the outfitting?
So we're looking at a refurbished one, and it's anywhere from $80,000 to $100,000 is what we've seen over the last 6 months as we've been investigating this.
So that's refurbished. What's a brand new one looking like?
No. Well, I mean, there's two. So if you're looking at a full clinic, like what our Charter Oak has, what CHC has, and other of our partners have, that's sort of next level. That's like $700,000, $800,000. Like they're very expensive. We're trying to find a mobile camper that we can retrofit to have like a meeting space, like a little office space to do vaccinations if we have to do them, and to meet with people to do counseling and those types of services. A brand new one would probably be upwards of 150 maybe is what we've seen, but we've seen some really, decent, more than decent, like, new used ones, as I like to say, that we can retrofit. But that's initially what we planned on budget, and I'm sure if we have to use more of that ARPA funding, we can work with the mayor's office and the COO's office for that.
What's the total amount of the ARPA funding?
I believe it was set aside $900,000, if I recall correctly, from the allocation.
How much again?
900,000.
Okay.
And so we've touched a little bit of that for monkeypox, or for Mpox. We touched a little bit of that for Mpox during that time. And so we've been working through what a robust plan can look like, and that will be a part of my transition to the mayor's office.
Do you know, estimate offhand, how much you've tapped into that you spent to date?
Not much.
Okay.
Not much. It's kind of, just to be clear, we're sitting on so much money, and we're trying to make sure the money that has a deadline that had to be used first is being used first before we tapped into that. But we also know that that money has a deadline, and so now we're looking at that for the next 2 fiscal years before it goes away.
Now, going back to the minibus, the RV, in comparison, is that the one that comes to my mind is the one that Connecticut Harm Reduction has?
Oh, that's a really nice one. But they paid about that much for it.
About 150? Because it has a little meeting space.
They paid, well, they got a great deal on that. They paid significantly less than 150. I don't know if ours is that large. We're trying to find something that's a little easier to manage. But I believe it's about the same size as the one that we have. So it's about half that size.
But if there's one, let's say, for example, the RV style, you'll be able to get that. That's something that the health department can be comfortable in operating,
If
right?
absolutely, I mean, if we got to train people to drive it, we'll train people to drive it.
So, that's a good one. What's one of your wish lists? What's on your wish list that you have not put on here that you would like to see the health department?
Oh, you're asking. I will say, and if I had a magic wand for everything, I always say that focusing on maternal and child health yields the biggest dividends. And so that would be, something that I would have always loved to do. We've done pieces of that in partnership, but I'm also very well aware of the fact that whatever we ask for has to come from someplace else. And so I keep that in mind. We're lucky enough to have access to numerous grants that allow us to fill a lot of our wish list items. And the ARPA funding is allowing us to fill, like this new RV is a wish list item that we have that will be fulfilled by ARPA funds.
Now, for the maternal child health, it's just more regarding, is that staffing? Is that creating a program?
Well, we have a robust program right now. I would love to make that even more robust. As many of you know, this week is Black Mamas Matter Week, right? Black Mamas Health Matters. And when we think about our Black community, our Afro-Latino community, our immigrant community, the challenges that they're facing, we know that a home visitor can make a difference. And so we have a robust home visiting program within both citywide through partnerships with the village and numerous partners that we sit at that table with. And then we have a smaller one within the city that we manage. I would love, in a dream world, and I know the state is working on this, and I hope that it comes true and we're able to take advantage of that, that any mother that wants a home visitor would have access to a home visitor. So if you think of a dream wish list item, would be that, but that would take money that far exceeds what the city would have, and that would
How
be
much?
us. I'm not going to give you a number right now, Majority Leader.
Give me a ballpark.
I would have to get back to you on that.
Please do quickly.
But I will say this, we do know that the state is working on several items related to this. And I believe that at least one of these bills will pass. If not, there will be Medicaid reimbursement that's also being looked at, and that would be a way that we can tap into doing that program without having to use city funding.
Yeah, because that's still being discussed regarding Medicaid reimbursement at the state. This is my last one because I know my colleagues is waiting for me to finish up. Does the health department focus on, because you mentioned maternal child health, even with that, and let's say reproductive health and the health services, do you have a focus on oral health?
No, we don't. We do not have a focus on oral health. We have had conversations with our medical director that were happening right before COVID hit, and we're hopefully will re-engage in those conversations now that the WIC office is opening for in-person visits. But we've had conversations around having UConn dental students come in and do sealants for WIC children, or for children whose families are on WIC. So that's something sort of like a little step into that as an added service that we can provide on site. And so I hope that over time we can develop that, but we don't have work that we do in that area specifically.
What would be the cost for that? Let's say that partnership is materialized.
I don't think there's a cost associated with it. It was more around COVID and there were no in-person visits for WIC at the time, but that's changing. And so slowly over time, we're getting more in-person visits. If I recall correctly, the federal government is going to require 2 in-person visits a year versus the 4. So it's a change. We went from 4 in-person visits that they had to do a year to no in-person visits to going to 2. So I think once that all gets settled and those 2 visits are required visits, because they're not yet required, we'll be able to engage in that program at no cost.
And where will those screenings take place?
Well, we have our WIC office, and so there's space there. We can dedicate a room to doing sealants.
Okay. Or just for consideration, either before you leave or your predecessor, I know the Hispanic Health Council is opening up their neighborhood center at the Mikasa, where UConn School of Dental Medicine will be doing screenings there. So that's just a plug for your for the residents of the city of Hartford. Okay, see, it's not my fault, it's yours now. All right, Council President.
So, Director Arroyo, these maternal visits, would it be possible for that to be in the evenings and on Saturdays?
So,
And I'm going to
that's
tell you why, because
yeah.
when Councilman Clark brought that up, so I was a single mom, and through my pregnancy, I visited the doctor 4 times, and it was because I had to work, right? So if I had a service like that, that was many moons ago, but if I had a service like that, I would have taken advantage of it. And I know that there are a lot of moms out there right now in the same situation, so that's a priority for me. So if you can get back to not only Councilman Clark, but email that to us. That is, I'm gonna say for me, a priority.
So I was just informed, Carmen, we do evening visits, and there have been also during the virtual times, later calls and virtual visits as well. So the Saturday visits are something that do happen.
Okay, thank you. And I'll follow up, on side.
You're welcome. Yes, please don't forget to get us that
Now he's
information.
not did something here.
Yeah, because.
But I'm leaving, so I won't get in
No,
trouble.
that's no, absolutely not. I think my colleagues know what I'm trying to do. we'll see. But thank you for that information. Thank you again for your presentation, for your great team behind you. Job well done, and wish you all the best and success in your next venture. And so buckle up. It's going to be fun.
Thank you.
Yeah.
Oh, don't make me cry.
And Carmen, thank you. Thank you so much for everything that you do, really.
Thank you. That's.
Thank you.
All right, we will now be in recess for about 10 minutes, and then we will have the Human Resources Department. leading. This is your third budget? Okay, so you're a pro now. And Deb has joined her, and Rich has joined her as well. So you have your whole team here and out in the audience, and so you may begin.
Okay. Good evening, Madam President and all members of council. Thank you for your time and for the opportunity to present to you this evening. I am Marlene Fleeting, Director of Human Resources and Labor Relations. I would like to thank Mayor Bronin and COO Montanez for this opportunity to serve, which allows me to present the Human Resources budget for fiscal year 24. I would also like to thank the best group of men and women that any director can ask for, my HR department. The staff works really hard and they're committed, and I truly appreciate their support. And I'm personally going to stand up and applaud them. I truly appreciate my team. They have a choice to work anywhere, and they choose to work here for the city of Hartford, and I truly appreciate each and every one of you, as well as my senior team that's with me today. Now we'll get started with the presentation. The Department of Human Resources is committed to providing effective guidance and support to all city departments with respect to hiring, managing, developing, and retaining employees, labor relations matters, and benefits administration. By establishing human resources policies and procedures, the department provides fair, consistent, and clear standards to be applied by the city of Hartford as an employer. The department provides direct services in the following areas: compensation, classification, benefits, employee relations, labor relations, training and development, recruitment, and HR technology. In addition, the department serves as a resource to department heads and the city administration on matters involving collective bargaining agreements and state and federal employment law. The recommended budget includes 16 full-time positions as outlined in the org chart. As you can see, our department is made up of 4 units: administration, employment services, labor relations, and benefits, with the majority of our staff dedicated to employment services. Some of the FY23 highlights: recruitment testing. To date, HR has administered a total of 27 examinations, including 5 promotional fire department positions and 1 promotional police department position, 5 entry-level police officers that included written, physical agility, and oral examinations, 8 emergency services dispatcher trainee tests, 8 maintainer 3 testing sessions to support the critical needs of the Public Works Department. Between April 1st, 2022 through March 30th, 2023, HR recruitments resulted in the hiring of 178 new employees and the promotion of 136 city employees. HR calculated over 257 retroactive salary payments to employees for negotiated general wage increases, developed student internship policies and procedures. In training and technology, HR and the Office of Equity and Opportunity partnered to ensure employees attended mandatory sexual harassment and ADA trainings. HR worked with several city departments for specialized trainings such as reasonable suspicion, communication as a supervisor, and professional communication and behavior in the workplace. HR has coordinated with the DPW team for the installation of digital signage in City Hall and Department of Public Works to disseminate messages to employees and the public. Some of our highlights for benefits and labor. For benefits administration, 4.6% 4-year average medical trend versus a 7% year-over-year expected trend. Medicare Advantage plan transition from January 1st, 2023, with a savings approximately $700,000 annually, or 33% reduction. A 0% increase in administration services only, medical fees for 23 to 24. Negotiated a 2% decrease in dental fees, saving $38,000 from 23 to 24. Negotiated a reduction of the individual stop-loss reinsurance fee from 22.4% to 19.8% for a savings of $17,600, driven by the loss ratio of a $2.8 million claim from 2023 to 24. Catastrophic cases equal 1% of population, 34% of spend versus averages 1%, equals a 28% 8% of spend. For health and wellness, we continue to implement employee wellness initiatives, including the following. Quest Diagnostics, we had an on-site biometric screenings, example blood pressure, cholesterol, glucose, and body mass index. Asthma in adults to improve outcomes and create asthma action plans with their providers. Diabetes and A1C in adults to improve screenings and educate individuals to manage A1C. For weight loss, we had the STEP Challenge from May 4th, 23 to July 2nd, 2023. In employment and labor relations, we continue to collaboratively work with leadership and city departments to identify critical vacancies and negotiate changes to job descriptions, pay, and qualifications to reflect current market data to assist with recruiting and retention. From May 2022 through March 2023, we updated job descriptions and pay for an additional 41 classifications. Through collaborations with the unions, we managed to keep the number of new grievances filed in FY23 to date to under 20. This is the lowest number of grievances filed in any fiscal year since at least fiscal year 2012. We closed 13 grievances to date in FY23, which is 69%, of which were resolved or denied at the HR level of the grievance process. Due to the extra funds that were allocated to marketing, we've been able to do multiple marketing initiatives through social media and job boards, including Facebook, LinkedIn, and Indeed. The overall performance from October 22 to March 2023, we had 45 ads launched, which means job postings. We had 179,788 users reached, which means these are the amount of people that actually viewed our ads. We have digital billboards located throughout Hartford, including I-91 and I-84, the XL Center, Church Street Garage, and the Convention Center. And you can see here on the page some of the ads. We also have interest cards printed and distributed to all public-facing city offices. We had UPS mailers sent to 10,000 Hartford residents highlighting specific job openings. We will have radio ads on Hot 93.7 and interview-style ads on News Talk 1080, top job segments. We also had local newspaper ads in Vocita Media and the Northern Agent. Our strategic initiatives: negotiate collective bargaining agreements that are fair and equitable, continue to partner with departments to prioritize the hiring of Hartford residents, particularly within public safety positions, continue to update policies, departmental procedures, and job descriptions, provide mandated and optional training opportunities to city employees, continue to automate HR systems to reduce administrative burden and increase organizational effectiveness. Our budget for FY24 is 2.7% higher than last year. The 2.7% budget change represents salary increases based on the January 2023 general wage increase and growth increments reinstated for non-union employees. Some of our budget highlights and areas of focus in FY24, approximately 48% of FY24 budget is allocated for recruitment and testing. Our FY24 budget includes funds for contractually required fire and police promotional testing and continued focus on technology. The areas of focus: we continue to focus on ways to attract Hartford residents for jobs to the fullest extent possible, with a focus on diversity, inclusion, and representation at all levels. We continue to partner with city leadership and city departments to identify critical vacancies and to update or change job descriptions, salary ranges, and qualifications to assist with recruitment, retention, and succession planning and employee transitions. We continue to encourage and engage all City of Hartford employees in ongoing training opportunities, including EEOC, ADA, diversity, inclusion and workplace sensitivity, OSHA, supervisory, reasonable suspicion, drug testing, and sexual harassment training programs. We will also develop City of Hartford employee recognition program opportunities, continue to review processes, policies, and procedures, and implement additional efficiencies within HR and across the city. We continue to partner with the Office of Equity and Opportunity to support and expand current workforce diversity, inclusion, and representation initiatives, including improved collection of the City of Hartford employee EEO data. This concludes my formal presentation. However, there are 5 additional slides in our appendix that represent our department demographics, Hartford residency, and EEO data for full-time employees as of February 23, 2023, and Hartford residency and EEO data from April 1st, 2022 to March 31st, 2023. I will now accept any questions you may have.
Thank you for your presentations. Councilwoman Hercules, do you have any questions?
I do not. Thank you for your presentation and your service, Director Fleeting and team.
Thank you so much, Councilwoman Hercules.
Thank you, Councilwoman. Council President?
Hello.
Hi,
Director
Council
Fleeting,
President, how are you?
Good. So, Councilman Nick LeBron regrets not being in attendance, and he sends his apologies. He had previously scheduled a commitment to a majoral debate being held today, so therefore he can't be with us here. He had a question, and that question is, we provided the extra dollars to help support hiring. How is that going?
I'll begin and I'll let my assistant director take over. We have partnered with, we hired Lumi advertisement marketing firm, and Lumi has done a lot of things. They have created, like I have here, they've created job ads. We are on LinkedIn, Facebook. We've had billboards. That did increase a lot of activity for hiring. We've done interest cards, mailers. We're going to be on the radio. We've been in the newspaper. And as far as how it's going, I'll let Pam take that question or continue.
Thank you. So we have seen an increase in applications overall, especially now that we've been doing the paid ads with Indeed. We did just send those marketing highlighted job interest cards through the mail to the Hartford residents. That just arrived last week. So we have received some phone calls from residents regarding the jobs and information on those and ways that they can, apply for the position. Lumi has also worked with us to provide materials for our job fairs and things like that, so we can catch the attention of job seekers at those job fairs. We're also using the funds to work with Red Thread and create digital signage in City Hall and in the Department of Public Works. And the Department of Public Works, a lot of their staff doesn't necessarily have access to computers and emails. So with this digital signage, we'll be able to show more promotional opportunities, make sure they're definitely hearing about them and seeing them so they have a lot more upward mobility. And then in City Hall, it'll be open to the public, so an easier way for the public to come into the building and really ultimately see every job opening, other than just, posted on a bulletin board or having to come into our office and ask.
Thank you, and through you, Chair. So looking at this marketing initiative of 45 ads launched and 179,788 users reached, how much did that cost, and how many individuals actually ended applying for the job? And you can send me an email on that, okay?
Yes, no problem.
Okay, great.
Thank you.
Yeah. Pretty much those were my questions. I just want to thank you, Director Fleeting, for your great job that your department is doing with the outreach and trying to recruit staff. And I also want to commend your staff for, like you said, right? They have the right to apply somewhere else, but they decide and choose to work for the City of Hartford. So for that, thank you. And thank you to your executive staff. That's all, Chair.
Thank you. Thank you, Council President.
Councilwoman Surgeon?
Thank you, Mr. Chair. Good evening, Director
evening.
Fleeting. Welcome. It's the second or third?
It's the third.
Oh, so you're well seasoned then. Okay, good. So I want to also acknowledge you bringing your mom with you. I want to acknowledge your being here. I'm sure you should be very proud of your daughter. That's great. So you're seasoned, so you've gotten used to what's beating up on you, so that's a good thing. I like your marketing outreach. I think it's wonderful. And I'm glad that you guys are keeping some data and the feedback and what's working and not working. So that's something that's a huge improvement, over the last year or so. So I want to thank you so very much for doing that. One of the things I looked at research, and you only have 16 full-time staff. It's standard. An HR normally is about 1.5 HR staff to 100 or so employee. Wouldn't you say that your HR staff is, your staffing could be improved?
Well, we can always use staff. We can always use staff, Councilwoman. We do the best that we can with the staff that we have. If we had more positions, then we would obviously be, recruiting, but we're
So let me ask you this. I think there's some people who've been here like for the last 20 or 30 years. Just from my, limited knowledge base, 20 years ago, there were more than 16 staff in the HR department.
Yes, there were.
So again, my question to you, I know the city employee numbers has gone down to about 1,400 or 1,600, if I'm not mistaken, for the
Yes.
right for the city of Hartford.
Yes.
I know 20 years ago with a little bit more employee on the books, but still at the same time though, 16 full-time employees servicing over 1,400 employees, plus you have a fire who's always taking classes, and the police department who always giving classes. Not quite sure, looking at your chart, how I would say that some of the complaints I've heard from the departments, in filling vacancies and getting things, through in a more effective time. I'm just wondering, if staffing is sufficient to get everything done. Every year there's a new contract negotiation that you're doing. One of the things we ask you from council is to start thinking outside the box on how you would, improve the quality of life for the employees. I like the department that it's doing more creative things, and, taking classes. So that's something different that the city has done in the last 20 years. So I certainly credit you with that improvement.
Thank you.
So I wanted us to touch on, I think you did mention that there is an increase in application. So from the applications that are coming in, is it from the demographics? Are they in Hartford residents, outside the city?
It's definitely a mix of all of it. We still are probably doing just about the same as we always have with the Hartford residency. I don't see too much of an increase in that. That's why we did try to target them with the mailers. That was something we only did for the residents. So we were hoping that would draw them in and let them know that this is a place that they can come to and have a wide variety of jobs. The jobs that we posted on the mailer really ranged from part-time to full-time to needing a lot of experience or no experience. So that was how we tried to target them to try to bring those applications in more.
I do see that you have a vacant position in your department.
We have 3. Yes.
And how long has that been vacant?
Well,
As a principal human resource analyst.
yeah, about a year for the HR analyst. The labor position, the principal HR analyst, has been open a little bit longer than that, probably a little over a year. And then the HR administrator just opened up when I was promoted to assistant director, so maybe about 6 months.
Oh, so this position is filled then?
The assistant director is, but the HR administrator emptied about 6 months ago when I promoted.
So this is under labor relation. It says vacant principal human resource analyst.
Yes, that one is vacant. It's been vacant for over a year.
Okay. Are you finding it as difficult as the other organizations, state and businesses trying to find qualified employees?
Yes, we are. And one thing that, you know, I as well as the senior team pride ourselves in is promoting from within as well. So we are finding it hard to recruit because obviously everywhere nationwide there's a shortage for employees. But so for the principal human resources analyst under labor relations, we're looking for someone with the labor experience, and that's been really difficult. So what we are trying to do is groom as we have our kind of trainee program in HR, so we're trying to groom our employees from within so they can promote up. As an example, to my right, our assistant director, she was, like she said, she was the human resources administrator, and she was promoted in October to our assistant director, which led her old position to be vacant.
I see a lot of staff leaving, going to the state and other organization. When you do first of all, is there any exit interview being done? That's number one.
Yes. Yes.
And number two, with the exit interview being done, what are you finding out why staff is leaving?
We do conduct exit interviews for everyone that we are told that are leaving for resignations, and the majority are going to the state. They're going for more money, and they're going for a more work-life balance. So a lot of them get to do a hybrid. You know, they get to work 3 days from home, and it's just things that we just can't compete with.
So the positions that they're leaving, if you were to take a look at the position as we did, I think a year or two ago budget, when we were competing with holding on to our police department and we did an outside review of the salary range, is that something you guys are consider doing? And then speaking to the administration, if you see, staff leaving, and number two with the staff leaving is the information that is not written anywhere that's going to. So is there any way to take a look at it and speak with the administration if you're seeing this position is leaving a lot more than another position, and how do we, address that situation with the salary? I think one of the things you guys did creatively was a CDA license, so that was creative thinking. So we're gonna have to start really thinking creatively if we want to compete.
We have done, excuse me, I'm sorry to interrupt.
Sure.
We have done some things. I'm going to let Deputy Director Carabello tell you about that.
Yeah, because that's one of my favorite things to talk about. But before Deb tells me about that, you said the state offers a hybrid. What is preventing the city from, if you don't have to be in person, what is preventing the city from offering those opportunities also?
Well, we were working in conjunction with the COO office. We're working on a work from home policy. What we did find with COVID did teach us at the city that some jobs can be done from home, and some jobs can't, obviously, that we know. So what we've been doing is some departments are able to work like a day from home once a week. Some department has allowed that hybrid schedule for some. And so directors are trying to do that to attract more people and retain our current staff for those that can. As far as citywide, it's a little bit more difficult because it depends on the position.
So could you give us a list of department or areas where that is being offered?
Yeah, I can tell you right now. It's finance. Finance allows work from home. DDS, I believe, allows.
But what position?
They're back in. Well, DDS is back in. So MHIS allows work from home. I don't know if Leonie does, but I'll confirm, but I know for certain those two departments.
So what if you could send for all the members is the positions who are given the opportunity to work from home, are they union position? How many are taking that opportunity up?
Okay.
And the name of the position. So it's it gives us a sense of, where we can hold on to these employees as much as possible. I think a retired state employee myself, was given that opportunity, to work from home or come in for a couple of days. And one of the things I find out, and I think I've talked with you on regarding at the at HHS committee meeting level, is the work-life quality that people are looking for right now. I think the city of Hartford gives an opportunity to serve a community, but we also have to remember that, that people have families that would like to take in consideration. So we'd really like to see some more innovative ideas, to be put on the table, so that will enhance your marketing of what the city has to offer. So, touched on all that. So, Ms. Deb, tell me what I want to hear.
Well, I did want to just mention that for the HR positions last budget, we came and asked for increases for kind of like our entry to mid-level positions, because those are the ones that we were having a lot of difficulty getting them in the door. For example, I think our HR analyst, our max salary, I want to say was $49,000 or something along those lines. And we came in and we increased it, and now it's low 60. And this year, what we did, we wanted to take care of those positions first, because those were critical and those were our entry level, and we wanted them to stick around, because like Marlene said, we're really trying to train up and give opportunities for upward mobility for those that we're hiring here, so that they stay with us. This year, we've come and we've asked for raises to increase the maximum for our management level positions. So in our budget, we don't have any actual costs associated with it right now, but to increase the HR administrator maximum, the assistant director maximum, and the principal, so that when they get to those levels, we have a little bit more room to offer a higher salary and maybe compete with the state or other municipalities. So we have tried to look at that. We've gone and brought comps to the leadership, and they approved, and you approved last year, so thank you for that. And if you approve this year, those maxes will increase for our management level as well.
Okay. Just one last issue, which I also, Director, have always talked about, and that is succession planning. I think the HR department is where we start, and that rolls out to all the department. And I would like to know, we've talked about this at several budget hearings in the past, how we're going to go about doing so, because as our demographics in the city ages, having a succession plan is important to pass on a knowledge which, all of us do a job and everything is not written down somewhere. So having a succession plan is very important. And I think your department could take the lead on showing the other department how that is accomplished.
Yes, you're absolutely correct. And we have started doing some things with having written policies and procedures and things of that nature, because like you said, even me, I've been here 22 years, right? And I'm the longest standing HR director since 2012, I think, for 3 years. And I've only been in HR 3 years. But what I'm doing is, as I learn, and what we have thank God for Deb and Joyce and all of our Rich and our senior team, we're starting to, and we're continuing to write down things, have policies and procedures, and do as much as we can with succession planning, so our next generation can continue on what we have. And you want to say something?
I also just wanted to say that we also are doing a lot of cross-training and giving opportunities for our staff, for example, to sit in on grievance hearings. In the past, when I first got here, we were kind of all employment services did all civil service, labor did all labor. And of course, we interacted and worked together, but when your duties were pretty much in that area. Now what we're doing is we're trying to provide our staff with opportunities to sit in on a grievance hearing, for example. And then as they sit in on a couple, take an opportunity to write a grievance decision. So that's how we're working in labor relations to try to, especially because we're having such difficulty finding labor, is to pass on that opportunity. We give them opportunities to sit in on a negotiating, to be part of the negotiating team. So we're trying to do that so that all of us are cross-trained in the areas. And the same with labor. If people come in with labor, they have to learn civil service first. When we hired our last person in labor who left us, he had to learn civil service first, and then he started to get into the contract and the labor piece of it. So we are trying to do that cross-training, and we're more actively doing that.
So I would say by, the next fiscal year, we should see some improvements.
I think we hope so. Yeah.
Well, that's a mission and a goal for the next year. one of the things I'm not really well versed in is the benefits. And, just talking with some of the employees and the benefits that the city offers, that's another area where I think, looking at the benefits, in getting good people to work for the city. What can we do about that?
Well, I think, from my perspective, I've been here for almost 15 years. The benefits haven't changed that much. There's been a plan design change in regards to how we deliver benefits, which is a high deductible health plan. But the city funds 50% of the deductible, which is a very, admirable thing to do. The city hasn't shied away from reducing that 50% deductible to zero since we've had high deductible health plans. I think our benefits are very comparable to any other municipality in the state of Connecticut. So, if anything, I think the issues with the salary was, being beholden to the MARB board for a number of years, where they were dictating 0% increases. How do you compete with that with the state of Connecticut? So the pendulum has swung that way, where we didn't offer our employees anything. And now the pendulum is swung the other way, where the state's got so much to give that they're poaching our employees.
Yeah, I know.
And I recall there was a 1716 union had a vote, and they voted down the high deductible health plan. Must have been 7, 8 years ago, maybe a little longer. And Governor Malloy was on TV berating our union, hardworking, the lowest paid union in the city of Hartford, how they didn't vote for a high deductible health plan. And in the same turn, the state of Connecticut kept their PPO. I mean, they talk from one side of, they can't do that. So, we took the lead a number of years ago with a high deductible health plan. It wasn't a big change. A lot of municipalities already have that program in place. We fund 50%. We offer a terrific insurance plan all around. And I think for the most part, and we do have a robust wellness plan. We do a lot for a little. And the fact is that when I came on board, our budget on the health side was $45 to $50 million. Now our budget's at $37 million. Net to the city is probably $30 million. So we've not only kept insurance plans, on par with other municipalities, but we also reduced our spend. And that wasn't simply by luck, by chance. It's the fact that we try to do more with less. We try to look under every rock. We go to RFP. We unbundle our health plan. We've switched to CVS through the state of Connecticut. We go through a coalition for our life insurance. We do everything we possibly can as a department to try to uncover some savings. And as I was talking to our management and budget director earlier, when there is a large amount of savings to be had, it's not easy to accomplish. When we transitioned from Anthem to Cigna 6 or 7 years ago, boy, that was a tough transition, but it saved us money. And in order to save money, sometimes you need to make the tough decision, and sometimes you have to have the staff to actually work the plan and get to fruition to get those savings. So I think the department has done an admirable job. I think the council and the mayors before and this mayor have done an admirable job about not reducing the benefits to the city of Hartford employees. I'm very proud of that.
I thought I heard the benefits were reduced. Am I mistaken?
Benefits were
remember.
reduced? No,
No.
we did transition to a high deductible health plan. And we recently, as our director had mentioned, we recently saved about 33 or 40 to 40% more so by transitioning our over 65 population to the state of Connecticut a number of years ago, and then we went to Aetna with them, which saves an additional amount of money for over 65. So they were paying $275 a month last year. Now they're paying $165 a month this year.
Dominic, so your retirees or whoever over 65, or whoever is still working over 65 is on a state plan?
Well, no, actually, our over 65 population that are still employed have access to our active plan, and they're on our active plan through Cigna. But we transition our over 65, which we used to which we used to pool in our underwriting here, which was, a number of years ago, and that was around $500 a month for that one over 65 individual. By transitioning them to the state of Connecticut and using a law of large numbers, 50,000 strong at the state of Connecticut, we've managed to reduce that spend to $165 per member per month for retirees.
Oh, for retirees. That's
I
what,
apologize. I
Yeah.
apologize.
All right. That would make sense. So,
Right.
what about the employees who are under 65, who are not retirees? You just gave me an example, piggybacking with the state or going with the state to save some. Would that be reasonable to say you could do the same?
Well, every year we price out the state partnership plan. So, the state of Connecticut had enabling legislation that allows municipalities like Hartford to actually shift their prescription drug plan or medical plan to their program. We did that through CVS, with CVS Caremark, and it saves, believe me, it saves millions of dollars for the city of Hartford. However, when we attempt to shift the entire population to the state of Connecticut partnership plan, and we price this out every year, last year their increase was 10.5%. Ours was about 4.5%. This year their increase is 7.5%. Ours is 2.3%. If we transitioned the entire population here to the state of Connecticut, on the active side, our increase would be 17.7% increase on the actives and a negative 2.3% on the retirees, for an overall increase of 9.4% to go to the state of Connecticut.
But that's the retirees. What about the
All
other
of us.
population? Everyone.
If I just transferred over active people and created a legacy group of retirees in the city of Hartford, I really couldn't do it, because contractually, the retirees need to be pooled with our active population, because our active population provides an implicit rate subsidy to the retirees. We as active people don't use the plan as much as the older people. So our costs are shifted to help pay for theirs. But if we had the ability to just shift over our actives, we would pay an additional 17.7%.
So what I'm hearing is the state active population is could be a detrimental with our city of Hartford in comparison to our city of Hartford. Okay, I think I'm getting that. All right.
Well, our increase overall for this year on our health
But you
plan,
said 3.4%, something like that?
2.3.
2.4%.
So I think that, in talking with our consultants and other consultants and peers throughout Connecticut in the municipal space, I don't think anybody's at 2.3%. I think the lowest I heard was 8%. So, once again, it's what we try to push here. We try to push wellness. We try to educate employees. We do everything we can to save the city some dollars. And that's not just us on this side, but it's the leadership too. The council, the mayor, and administrative staff, we're all working together to save costs. And, we're moving forward on that. And Julie and I were talking about other initiatives. So we're just proud of the whole program, and we're proud of our staff, and we're proud of the city. And we've done we've done tremendously well.
Great. No, thank you. I see that is one of your highlights. So that's really good to hear.
Thank
Anything
you.
to save our taxpayer dollars,
Oh, absolutely.
some funds. And I know health cost, and we're self-employed. So I know health cost is extremely expensive,
Yes.
so I truly understand that. So thank you, Director,
Thank you.
for bearing with me and my questions, and thank your staff. And I see you had a lot of people here with you. Is that all 16 people?
We have pretty much just about every last one of our staff members are here except one person, I believe, right? Just one person. We believe strongly in our team and we support each other, so we're here in the masses for this budget.
Well, welcome, Human Resources staff. I've never seen you guys before. So this is really nice to actually see everyone in person. And want to thank you guys for this, working for the city of Hartford and for the service you provide to the resident. I truly do appreciate it. they're not really beating up on your director too badly. After the third year, she's gotten used to us now, so she knows what we are actively looking for. And I think we just really would like to see, services being offered to the staff, of the city of Hartford, and try to make this the best place and want people to come to work for. So thank you for doing that. Thank you, Mr. Chair.
Councilwoman Surgeon.
Councilman Hernandez.
Good evening.
Good evening.
Almost every week I received many emails with new vendors calling themselves to be the best, the experts at onboarding, recruiting, performance management. It's like, this is the hot topic right now. So many of them. They reproduce themselves, I don't know how, but somehow there's so many of them out there right now. So that leads me to this question. Do you have any mechanism or any data tracking that you do to measure the effectiveness of the different tools that you're using with your different vendors and solutions that you have chosen? For example, beyond just how many users you reach, for example, like the quality of the users that are reaching or the quality of them that are applying. I know, for example, an employer that chose a solution. They pay a lot of money for it, and at the end of like the 6-month trial, they determined that almost 85% of every applicant didn't even have the qualifications for the positions. So it was just money basically waste at that point, because the solution was reaching a lot of people, but it was also opening the door for a lot of low quality applicants. Another way to look at the question is, out of the 178 new employees that you hired in this year, how many of them came through which method? Just to determine, which are the solutions or the methods that are more effective. And so my question is kind of around the effectiveness of the different tools, and if you have any tracking way of measuring that on a real-time basis, so that way you could react or proactively react, quicker, in changing solutions or changing, methodologies to hopefully, attract the candidates that you need.
Thank you. So we do have an applicant tracking system, and it does ask applicants where they have found this job posting at or where they got the information to post from. So we are able to see the applicants who are coming from Indeed or LinkedIn, or if it's from a bulletin board. There's a lot of different options that they can choose. With the new funding for this year, we're really trying to do some trial and error. So we did a lot with Facebook, and we did put some money into it, but it really wasn't driving applicants our way. And then we worked with LinkedIn, and we tried that, and Indeed seems to be, doing the best. So we are able to track that a little bit through NeoGov. I think we're just trying so many new things, and our goal right now is to get the word out to anybody and everybody that the city of Hartford is a great place to work, that there's benefits you can get here opposed to in the private sector. So right now our focus has really just been to get the word out to everybody as much as we can. We'll always get applications of people who might not necessarily meet the qualifications, but those are helpful also, because that really shows us if someone is close to meeting the qualifications, or maybe they're short a little bit, that we can go into discussions with the unions and the departments to see if maybe that means there's a change needed for the qualifications. So we do appreciate any application that comes in, because we definitely can learn from it. I think as we continue to work with the marketing services and try these different initiatives, we'll be able to target the more specific areas that we need, especially for development services and the needs they need with academic development, and using some resources to see who has trades and licenses that we need for these positions. Right now, we've really just been, like I said, focusing on just getting the word out and letting people know that they can work here. There's a variety of positions to work here, and then we'll be able to focus a little more targeted on our initiatives.
Thank you.
Mm-hmm.
Council President.
Actually, Councilman, I'm going to send my question, a follow-up question, through email. Thank you.
Thank you.
A few questions. How many of the, thank you for the appendix information regarding the EEO statistics. but how many of the staff currently, between non-white and white, are in managerial positions? So how many managerial positions for non-white, and how many are in managerial positions for white?
For the city in general or for our department?
For the city in general.
I could get you those numbers.
Okay, thank you, please do. How many non-white are managerial in the city, and how many white are in managerial positions? Yeah. You just send that to the entire council, when you get that number, please. Regarding the staff composition within the Human Resources Department, what is the percentage of your budget that's allocated to part-time staff?
You said the percentage allocated to part-time?
Yes.
Not sure if I know that number. No, do you have it?
Or if you have a dollar amount, how much, so it's a two-part question. How much in salary is paid to part-time staff in addition to that, which I would include either consultants or contractors?
We don't have any consultants, but I can get the number for the council,
Okay.
for you and the council.
Thank you.
You're welcome.
For these, the benefits, I've heard some, and it's more so through the unions, there are issues with meeting the deductible. That is actually, those that have families, they struggle with meeting that deductible. When you're pricing out the cost plans for the insurance packages, how do you weigh that into effect? I know some of the unions have their contractual obligations based upon the labor contract, but is there any way that can be, when it's time for a new contract negotiation, that those factors can be factored in?
Yeah, if there's changes to the deductible, then that would be factored into the cost of the plan. So it would translate to a change in the premium amount. So if there was a less amount of deductible, so it's less out of pocket by the employee, it would be a higher premium to the city. So either that, or the city makes an effort to increase their contribution from 50 to something north of that to satisfy the 2,000, 4,000 deductible. So there's probably a number of ways you can probably approach that question and find a way to make it more amenable for everybody.
So is that something with that approach, and thank you for your answer, is that something that's like talked about now, or is that talked about when, let's say for example 17, 16, when it's time for their contract negotiations? Do you have like a pre-conference, like in law there's a pre-conference trial? Do you have those strategy sessions?
Well, I mean, I don't want to speak out of turn with a labor matter. I would have to defer to that question to labor on the timing of something like that.
Usually when we're getting ready to go into contract negotiations, we have a meeting with leadership and costs are looked at and proposals are put forward. We also put out an email and ask department heads to give us requests and, things that they've either had an issue with or they would like to see change. But as far as insurance goes, our direction would come from leadership.
Okay, and leadership, that means, is that the union leadership or the?
No, I'm sorry, the city
the
leadership.
City's leadership, okay,
Yep.
thank you.
You're welcome.
Do you do an analysis within the unions on those that have families, since that's a higher cost for insurance? Or is it like a blanket approach?
No, as far as for underwriting purposes, Councilman, we don't do it by union per se. We could figure out, well, for negotiation purposes that labor might ask me, they can say, Rich, parse out how many tiers, single, double, family. We parse it out and we make approaches on what if assumptions. So that's doable. We can always do that if that's the question.
Okay, all right. No, that's good knowledge. You had something else?
Are you asking if we've ever looked at it through tiers?
No, it was just a question. So
Oh, okay.
I'm assuming that you do look at it through tiers, but it's just based upon the direction that's given, that's the approach that you go, the avenue that you take, right?
And, yes, and Councilman, if you can just indulge me. So, you know, and we always look at the ability for union memberships to pay, especially the lower paying unions, i.e. 17, 16, where their benefit after deductible is $0. So once they reach that deductible, which is paid half by the city, they pay nothing. So every other union has a maximum out of pocket once, say myself or police fire, once they reach the deductible, they pay 10% of every claim until they reach the max out of pocket, 3,000 or 6,000. 17, 16 doesn't have that. So not to say that that's this great panacea, but it does help a little bit with the lower paying unions that they don't have any more out of pocket than that deductible. And they know what they're going to pay, the max they're going to pay in a year. It's $2,000 for family or $1,000 for a single. That's the max they're going to pay, besides the premium cost share.
Got you. For your non-union employees, do they have a different health care plan than your unionized employees?
No, certain plan designs are a little bit different with all the unions, but they're more or less the same. Everybody has the same high deductible health plan with some nuances or some non-standard benefits or this or that. That's through negotiation, but for the most part, all the unions have the same plan design,
Okay,
including non-union.
okay. I remember you had certain, back in the day, you had certain departments, and God, I feel like I'm dating myself kind of. You had certain departments that had, like particularly police had HR personnel inside their departments. And given the fact that I know that and I commend you and your department for trying to be creative and trying to be more, I would say maybe spontaneous or proactive in trying to address our workforce shortage. Have you given any thought as to possibly expanding the reach of HR and putting maybe some HR analysts within the departments to help out with recruiting and interviewing, since right now everything comes into HR, right? You go through your process and then you send out your cert notifications to your departments. But just trying to think of out-of-the-box practices, have you ever given any thought to doing something different, such as what I just said, having HR staff within the departments and going through the department level?
Yes, we have, and are currently looking at that. We are once we fill our other position as well, we'll have a more reach, right? The long-term plan and actually short-term plan is to be able to have our analysts go to the departments and visit the departments and actually have hours inside their departments where, like currently, they meet weekly with their departments. You know, they see them on screen, but we actually want them to go and actually sit in and be that human resources advocate inside the department. So we are working to do that. We just had a new analyst start maybe a month ago or so. So we're building up our department, and those are things that we're going to be doing very, very soon, and as well as working on other things that, like you said, you dating yourself. But when I started 22 years ago, we had things like, no employee orientation. We had things like that. So those are things that we want to bring back. We want to be able to have, when employees start, we want them to be able to have a meeting with benefits, with HR, with pension, and do an orientation that we used to do years and years ago. So we're working on doing that as well.
Has it always been that when a person applies, it goes to HR before it's a cert letter sent out to the department for them to do the interviewing process?
For classified positions, yes.
Okay, so it's just classified positions. So non-classified, it goes to that particular department?
It can. Sometimes they ask for them to go directly to them. Other times they ask us to look at them first and then give it to them. So for unclassified, it varies.
And the reason for classified because of the civil service state statute? Okay.
That is correct.
All right. Any follow-up questions from my colleagues? All right. Thank you all so much. It's not my fault.
Sorry. When is enrollment coming up? Is it next month?
I'm sorry.
Open enrollment?
I'm sorry, open enrollment, which will be communicated in a day or two, is May 1st, a Monday, through Friday, May 26th.
Okay. Is
May
Stacy, okay, I'm sorry, go ahead.
No, I'm just the month of May, per se.
Is Stacy here?
Yeah.
Who is Stacy? Hi. I just wanted to put the name to the face and personally thank you for your assistance on my transition when I came over. You made it very smooth, and even though it was COVID, your sense of urgency is very much appreciated. And I've heard the same from other staff, and I'm pretty sure that, everyone is at the same level as you are, but I just wanted to put the name with the face, that's all. Thank you.
No, thank you, Council President. I often call our benefits department our silent, and quiet storm, because they are now a staff of 3, but that was just recent. They have been a staff of 2 for quite some time, and they work tirelessly for the employees, for the city of Hartford. You would never think that it was 2 people running that department. You would think it was, probably
God.
20. So Stacy, and Stacy, she has that enthusiasm, she has that drive. You see Stacy walking, just as fast at 8 o'clock in the morning is the same at 5 o'clock in the evening. And I commend them all the time
Yes.
and thank them for their dedication and hard work.
Yes, thank you, thank you.
And thank you for recognizing that as well.
Stacy and Rich have been, I think, the wind behind the wings of HR and benefits for as long as I can remember.
Yes,
So
yes,
as
they
I'm
have.
glad to see that you do have some consistency and institutional knowledge. As Councilwoman Surgeon always says that, we are losing our institutional knowledge within the city of Hartford. But it's good to see that HR does still have that institution. And Deb has been around for as
Yes.
long as I can remember as well. I did have one question, and I probably know the answer to this, but I know through the Access Health Exchange, can the city go out to Access Health to price out plans?
Well, I think the Access Health Exchange is just for people that don't have an opportunity to purchase health care in their employment. So
There are some businesses that actually do go out to Access Health to have a health care plan
Right.
for their company.
I think it may be small employers.
Okay,
Yeah.
that's, all right, thank you. Answering my question. All right, so thank you all so much for your presentation, and please don't forget to give us those follow-up answers to the questions. And the meeting's adjourned. I'm just going to let the public know regarding schedule for Monday.
Okay. And thank
And-
you, the council president, majority leader, and councilwoman, and councilman, even Councilwoman Hercules, and the absentees of the council. We just really appreciate you. When I came in, a couple of years back, you've been supporting me and our team, and you continue to do so, and it means so much to me and the team. We really appreciate your support, and we look forward to continue working with you all.
Thank you. And thank you for staying with us and continue to stay. To just have that balance of you being here for 3 years and constantly seeing you is much appreciated.
Thank you.
So thank you all.
Thank you.
So Monday, before you adjourn, if you want to come back on Monday, that would be great, to help fill the room for your colleagues. But we're just going to have one department on Monday, which is the Department of Family, Children, Youth, and Recreation, and we are adjourned until Monday. Have a good evening.